morning, everyone. I will talk to you about the challenges to biobanking in lower and middle income countries, especially during the COVID-19 pandemic, as well as the time to reconceptualize research ethics guidance for pandemics and public health emergencies. While the collection, storage, and sharing of biological materials are complex due to the associated ethical, legal, and social implications, the situation becomes more contentious during epidemics, pandemics, and public health emergencies. Collecting samples during the outbreak and storing these for future research are a public health imperative. However, ethical concerns related to biobanking seem particularly important to consider in light of COVID-19. These concerns include sharing of biosamples, benefit sharing, and informed consent. Participants in biobanking research are generally required to provide consent for the storage and future use of biosamples, yet the possible associated risks remain largely unknown. Prior to COVID-19, the contention between specific and broad consent in biobanking raised ongoing concerns over participants' autonomy versus the need for scientific advancement. COVID-19 presents unique challenges to obtaining informed consent for biobanking research. Obtaining a sample from a patient may be difficult, especially when the patient is unconscious, has impaired cognition, is heavily sedated, or is too sick to engage with the consent process. Similarly, obtaining proxy consent from the patient's family could be challenging, especially when the restrictions are placed on hospital visitations. Furthermore, in the context of a pandemic, the public health principles of solidarity, mutuality, and reciprocity strongly support global sharing of data and samples. Yet, in the context of the current pandemic, inequities in vaccine access and distribution have already threatened global sharing and possibly exacerbated pre-COVID-19 inequities in health care. When benefit sharing efforts, as in the case of vaccine availability, excludes the very communities and countries that provided the samples for research, this fuels distrust and suspicion in biobanking. Examples of such distrust in biobanking could include the Indonesian government's refusal to share samples of the H5N1 virus with the World Health Organization in 2007 unless they were assured access to the vaccines that were created from the shared samples. More recently, the example illustrated on the slide highlights the challenges that can occur when material transfer agreements or data transfer agreements are not in place, or if the existing contracts fail to provide the necessary data and sample protection for both the institution as well as the research participants. Therefore, to ensure ethical biobanking practice, stakeholders such as researchers, biobankers, or research ethics committees need to be cognizant of the hidden complexities surrounding collection, storage, and data sharing, and that the appropriate planning occurs at a biobank governance level. There is a need for biobanks to strengthen access and the conditions or stipulations under which data are shared during the pandemic. One possible approach to increase data sharing between institutions could be through the use of secure online data management systems, which could facilitate collaboration rather than proprietary transfer. There is also a need for ongoing capacity building for members of data and biospecimen access committees to ensure engagement with issues related to biobanking practice, as well as the protection of participants' interests and privacy. Another layer of governance for the biobank could be the Biosafety and Biosecurity Committee that is set up to review and access or monitor biosafety and biosecurity risks. Likewise, the research ethics committees, or IRBs, should conduct careful risk-benefit assessments in the review of such research protocols, and I will discuss this a little later. With regards to the export of samples, there should be unambiguous material transfer agreements with clear specifications on how individuals' and communities' rights and interests are protected. The transfer of samples should be in accordance with country-specific legislations on material transfer agreements. So let's return to the ethics review process. The following can be considered. What are the country-specific legislations related to consent for research purposes? What country-specific legislations permit collecting, storing, and sharing of samples for research purposes without informed consent? What, if any, additional mechanisms are in place to protect the privacy of research participants, such as anonymizing samples and data? What oversight and monitoring processes are in place for approved research during the public health emergency? In countries where a waiver of consent is legally permissible for research purposes, has a risk-benefit assessment been done to determine the appropriateness of relaxing human research subjects' protections to facilitate the proposed research? For example, are the risks of not obtaining informed consent outweighed by the societal benefits that are likely to accrue from the proposed research? Also, is there an equitable participant involvement so that there is fair distribution of possible benefits and burdens associated with the research across both the lower and middle income countries as well as the higher income countries? Reviewers could also ask questions related to what type of community engagement activities are planned for the proposed research. At the same time, researchers can think of some of the community engagement measures that have been outlined on the slide. Reviewers could also think about the following. Are there clear plans for sample and data sharing to accelerate the proposed research process? Do research collaborations between low and middle income countries as well as high income countries involve adequate benefit sharing and capacity development? Can data be shared via a secure online data management system to facilitate collaboration rather than proprietary transfer? What mechanisms are in place, such as MTAs and DTAs, to ensure that resources are not shared with unauthorized third parties? What existing legislations, if any, guide sample and data sharing? And do these legislations make allowances for public health emergencies? Reviewers need to also think about how will biosamples be safely collected from research participants, especially in the context where personal protective equipment and resources may be scarce? What measures are in place to ensure a safe working environment for researchers and laboratory staff? And what biosecurity and biosafety measures are in place? Thus, the current COVID-19 outbreak provides a unique lens to allow a relook at sample collection and storage for biobanking research. Despite the highlighted challenges, there is nevertheless an urgent need to optimize sample collection, storage, and regulated sharing to accelerate a shared research platform that could ultimately benefit all nations affected by COVID-19. Likewise, any therapeutic or preventive interventions that result from data and/or sample sharing must be fairly distributed, ensuring equitable access to all. Thank you so much for listening to this presentation.